Ear infections can be irritating for both your pet and you. Let's investigate. Hey everyone, I'm Dr. Holmes and welcome to another episode of Pet Doc Sherlock, where I help people solve the mysteries of pets. And we're going to do a little something different today. We're going to do more of a presentation style, all about ear infections in dogs and cats, from why they happen to how we diagnose them to how we treat them. And this is a little glimpse into kind of part of what I do now as a freelance medical writer, is creating presentations for different companies. And so I thought I might use this in my videos, and so let's get into it. So, ear infections in pets are a little bit different than ear infections in people. In people, you hear about kids or babies getting ear infections, and typically that's a middle ear infection or an inner ear infection, whereas dogs and cats get otitis externa, which otitis means inflammation of the ear, externa means outer. And so that's an infection of the ear canal or the pinna. You wonder, what's a pinna? And that's the outer part of the ear, the floppy part in some dogs, or the part that sticks up on top of the head in cats. And we can have acute ear infections, which pop up out of nowhere, seemingly, and they're all of a sudden there. Or we can have chronic ear infections where they're on and off for months at a time. Or perhaps it's been a mild chronic ear infection and your dog or cat hasn't shown any signs, and then finally they start to once it's bad enough. And then we have different components, different causative agents of an ear infection, the most common being ear mites, bacteria, or yeast. So how does your pet get an ear infection? Well, first we'll look at predisposing factors. These are factors that increase the risk of your pet getting an ear infection. It doesn't mean they will get one. It doesn't mean they're going to cause one. It just means they're more prone to getting them than other dogs or cats. And the first one is ear hair. This is especially common in your smaller dog breeds like Yorkies, Shih Tzus, Papillons, Cocker Spaniels, lots of dogs that tend to get groomed regularly. Again, having ear hair doesn't mean they're guaranteed to get an ear infection, and that brings up, do we pluck ear hair or not? And currently, if you talk to any veterinary dermatologists, they say, don't pluck the ear hair unless your dog has an issue with ear infections already. Now, I know lots of you are saying, every time I take my dog to the groomer, they pluck its ears and it's never had a problem. And that's fine, but the thought behind this is that if you've ever had any hair waxed anywhere, or like me, a toddler on your shoulders who's yanking hair out of your head, you know it's not very comfortable. And that's because it's causing pain and inflammation at the site of hair removal. And so we're doing the same thing in our dogs, and that inflammation could potentially lead to an ear infection there when there wasn't one to begin with. Also, it's not terribly comfortable for your dogs. So again, if you think about it and you want to, you can let your groomer know, hey, let's not pull the ear hair this time unless we have an issue, and then we can start doing it again. Another predisposing factor would be stenotic canals, and those are narrow canals, or maybe there's a mass in that canal making it more narrow, and this prevents wax from moving out of the ear and prevents adequate airflow in the ear. Next, we have excessive earwax. I've seen several dogs and cats who just have a lot of waxy buildup in their ears. Some of them never have infection issues, whereas others, that wax allows different bacteria and yeast to grow in the ear, resulting in a problem with ear infections. And then another one is cleaning the ears too often. Each time you clean the ear, you introduce moisture into the canal, and if you're using cotton balls or an ear swab or something like that, you're rubbing the skin inside the canal, and that can cause some mild irritation. So I tell people, if you need to clean your dog's ears, if they don't have issues, maybe once a month is fine. If they've got ear infections here and there, then every other week is also fine as well. And then lastly, for a predisposing factor, we have the environment. Depending on where you live, if you're like me and you live in the southeast, it can get really hot and humid in the warmer months. And bacteria and yeast love that environment, and so we see a lot of ear infections during that time of year. So those are our predisposing factors. Again, factors that increase the risk for an infection, not directly cause an infection. So if your dog or cat has some of these, it's just an indication that we need to keep an eye on those ears more often. Not that they're guaranteed an ear infection. Next, we have primary factors. Now, primary factors are diseases with direct effects to the ear canal themselves, much more likely to directly cause an ear infection. First and foremost, we have ear mites. I have a ton of clients who come in and they say, Doc, I have been treating these ears with ear mite cleaner that I got at the store over and over, and it just won't go away. That's because it's probably not ear mites. Ear mites are way more common in puppies and kittens, young dogs and cats with a poor immune system. We do see them in adults, so we'll still look for them. And we will especially see them in geriatric animals where their immune system also has kind of backed down a little bit. But more often than not, if it's a middle-aged or slightly older dog or cat, we're not dealing with ear mites, we're dealing with something else. Another primary factor could be allergies, hypersensitivities. So food allergies, environmental allergies, contact allergies. So they touch some kind of chemical or some kind of plant that they're very sensitive to, and it causes inflammation of the skin, inflammation of the ear, and we get an ear infection. Endocrine diseases can lead to skin issues and ear issues. A big one's hypothyroidism in dogs. But you can also have diabetes, you can have Cushing's disease, you can have several others that will have an impact on the immune system and an impact on the skin and ears as well. And then last, we have masses in the ear. I know those were a predisposing factor as well, but if you have enough masses in the ear or a large enough mass, then they can just kind of harbor infection and be more of a primary factor than a predisposing one. And this is a picture of ceruminous cystomatosis in a cat, which is not common, but certainly something that can be a primary factor for ear infections. And so, what do we do to diagnose an ear infection? When you come to the clinic, what happens? And we'll do a full exam of your dog or cat and look for other areas on the skin that are problematic. Are there any infections anywhere? Do we have flea issues? Do we have evidence of an allergy? But to diagnose an ear infection, we're going to get a sample from the ear itself, which involves taking a cotton swab and sticking it down in the ear canal. That way we can get some of that gunk that's in there and take a look at it. Now, when you're in the exam room, you might notice that your dog or cat flinches, yelps, growls, something along those lines when that swab goes in the ear. Now, in humans, we have one horizontal ear canal and then our eardrum. And so if you're sticking a Q-tip in your ear, if you go too far, it's not comfortable. And you could actually puncture your eardrum if you did it too hard. In dogs primarily, but also in cats, their ears are a little bit different than ours. They have a vertical ear canal, then they have a horizontal ear canal, and then they have their eardrum. So as long as we're taking that ear swab and we're straight up and down, and we're not like pulling the ear out or going in at an angle, we can't hurt anything important. We can't rupture an eardrum, we can't hurt any major structures. Their discomfort is likely a product of their ear infection, not that we're running into anything important in their ear. So if they seem uncomfortable, it's because of their infection and we're not hurting them when we do this test. We'll then take that sample and we'll put it on a couple microscope slides. One, we will put some oil on to look for those ear mites. The other, we're going to do a special stain, and then we'll take it over to the microscope once it dries. What we're looking for, again, are ear mites, and they're very easy to see, they're very easy to find, and they'll be kind of like crawling around in the oil under the microscope. And they're pretty neat to look at, but it's very easy to tell when there's ear mites present. The next thing we're going to look for on the stained slide is bacteria. There's two types. One is called gram-positive. They're blue little circles, and that tends to be some kind of staph. People think about MRSA, but don't worry. It's not a type that you can get from your dog or cat. It can't transmit from your dog to another dog or cat to cat, unless you were to take like a cotton swab and stick it in the infected dog's ear and then put it in another one, which I'm not really sure why you would do that. So gram-positive bacteria, one thing we're looking for. Another is gram-negative. Those are red, typically rod-like in shape, so think Mike and Ike or hot tamales, and that's usually some kind of Pseudomonas. The next thing that we're looking for are yeast, a fungus in the ear, typically something called Malassezia. Yeast look like little snowmen or bowling pins, especially when they're dividing and replicating. And so they're pretty easy to find as well. So those are our kind of big three: gram-positive bacteria, gram-negative bacteria, and yeast. And those will guide what kind of treatment we use. Recently, a study from, I think, 250 or so samples from across the United States were sent in of ear infections from dogs, and they were compared to healthy dog ears, and they found that about 70% of the samples had bacterial overgrowth, about 16% had yeast, about 7% had both, and then another 7% were listed as other, or kind of undetermined. In those cases, it could be that there was a few yeast present that would otherwise be normal, but that dog or cat is just extra sensitive to the yeast. So once we know what's causing the ear infection, we can move on to treatment. And the first thing that needs to be done is a good thorough cleaning of that ear. I'm going to show you a gross picture real quick. I didn't want to show a ton of them, but this is what an ear infection can look like. And if you don't clean out that debris and that material, essentially it's pus, it's full of bacteria, it's full of yeast, it's full of disgusting, foul-smelling things. If you don't clean that out, you're not going to get rid of the infection, period. So we have to clean that ear. And if your dog's ear looks like this or your cat's ear looks like this, we're probably going to have to sedate them to adequately clean it. It's not because they're mean, it's not because they won't tolerate it. That may be true, but it's more so the fact that that's going to hurt and they're not going to want to sit still for it. So don't be too surprised if you've got a really bad ear infection in your pet that your veterinarian comes in and says, hey, we're going to have to sedate them for their own comfort. But the cleaning process, there's kind of two ways to do it. You can take the cleaner and you can squirt it in the ear directly. Some dogs will tolerate that fine. Most cats will not, and other dogs won't either. So what I like to do is take a cotton ball and soak it with the ear cleaner and put that cotton ball in the ear and kind of squish the ear around from the outside, and that gets the cleaner down into the ear. And then you repeat that process with wet cotton balls with the cleaner, dry cotton balls, until they come out clean. Again, think about the anatomy of the ear from that model we looked at. If you're going straight up and down, even with a Q-tip, you're not going to hurt anything important. So don't worry if there's a little bit of kind of jerking away. You're not hurting anything major in that situation. Now, medication-wise, once the ear is fully cleaned, we can medicate with a topical medication, a squirt of a medication in the ear. And there are several that we can send home that some are once a day, some are twice a day, usually for 10 to 14 days. Now, if your dog or cat doesn't let you put stuff in their ear, there are some leave-in options that your veterinarian can do at the clinic. There are fewer options for cats in general because they're more sensitive to medications. But it depends on if it's gram-positive bacteria, gram-negative bacteria, or yeast, or a combination of those as to what your options are. Now we need to talk about some of the complications that might arise with treating ear infections. And the biggest one is incomplete treatment, so stopping the treatment before we have completely resolved the infection, or repeated treatments using the same medication. Both of those will lead to something called resistance. So if you have an ear infection and you start a treatment, you should start seeing improvement in the ear. No more discharge, no more smell, no more inflammation. They're not scratching, they're not shaking their heads as much. And so then everybody's happy at the end of the day. We've gotten rid of all of the bacteria or all of the yeast, and everything's healthy. But what I run into sometimes are people who say, yeah, their ear looked great, so I just stopped the medication. That's not ideal. We want you to use the medication for the full 10 to 14 days. And the other thing I run into a lot is people will call me and say, hey, their ear infection's back. Can I just get some more of that stuff that we had last time? And a lot of vets are very nice and will say yes. and I've done it. I admit that I've done it, because we have sympathy for you and empathy for you. We don't want you to have to pay for another visit. We don't want you to have to pay for more testing. But the reality is, if we don't look and evaluate that ear, we don't know exactly what we're treating. And if we just keep treating with the same thing over and over, we're going to have problems. So what happens is, we treat with a medication. It's looking great. And so you either stop the medication, or we've used this medication before and it's not completely gone, the bacteria or the yeast. It's gone in terms of the ear looks great, there's no more inflammation, there's no more smell, they're not scratching at it, so it must be better. The reality is there might be a small amount of bacteria or a small amount of yeast still there. Then what happens is that bacteria divides and replicates, and then we get a little bit of inflammation. The yeast comes back, and we're back where we started. And so I get a phone call. Hey, the ear infection's back. Can I get some more of that medication? And if we do it again, then we use the same medication, and now we're left with a little bit more bacteria and yeast than we even started with. And this is resistance. This is where you're using the same medication over and over. You're not using it completely, and so now there's a little bit of bacteria and a little bit of yeast left behind each time that has seen that medication before, so now it doesn't work on them. And that's a problem. There's been some recent papers showing that yeast especially is becoming more and more resistant to the medications that we have on hand. And so what happens is your dog or cat's going to get an ear infection that we now can't treat, or we have to reach for a stronger medication, and there's no guarantee that it'll work. And if we end up in a situation where your dog or cat has infection after infection after infection, we're now into the chronic ear infection stage, which can be a very difficult complication to deal with. Chronic ear infections lead to glandular hyperplasia, glandular dilation, epithelial hyperplasia, hyperkeratosis, stenosis, a lot of big fancy words, but if we break this down into an easier to grasp concept, think about wrestlers or boxers or UFC fighters. They get these odd looking ears known as cauliflower ear, and that's because the ear has been beaten over and over again, causing inflammation, resulting in all of these things, which create this basically scarred ear. And the same thing's happening in your dog and cat if they get ear infection after ear infection. And so if you look at this dog and its ear, there's no more ear canal there. They can't hear, and if there's infection present, we can't clean it out. We can't get to it. We can't remove the infection. There is no medication in the world that's going to open those canals back up. And so what we're left with is we have to do a surgical procedure called a TECA, total ear canal ablation. And that's where we have to go in and remove the vertical ear canal and the horizontal ear canal. And a lot of people are hesitant to do this because they say, oh, but now they can't hear, they're deaf. Well, that dog is already deaf. That cat's already deaf. There's so much scar tissue and inflammation there that their ear canal is closed. And it's more likely that the eardrum is damaged because of all the infections as well. So don't let the fact that they can't hear out of that ear deter you from pursuing that procedure. Now, I understand that there's costs involved. Not a lot of general veterinarians can perform that, so you're going to have to go to a specialist sometimes, and that's a dramatic expense. So I'm not talking about the cost aspect. I'm just saying don't let the possibility of your dog or cat being deaf deter you because they already are. Another complication we can see is something called an aural hematoma. Now, you've got cartilage inside the ear with skin over top, and a hematoma develops when the blood vessels between those two layers are damaged, and it creates a balloon of fluid up underneath the skin. And this can happen from scratching the ears. More often than not, it's in dogs, from them flopping their heads back and forth and shaking their heads. But we do see it in cats as well. It's recommended to do a surgery to repair this. We basically make a cut down the middle of the ear, drain all of that fluid and material, and then suture the skin to the cartilage so that it doesn't balloon back out. again, with surgery, there's an expense and there's recovery time involved. So it's not simple, but it will fix the problem. The most common alternative is not preferred, but understandable if costs are a concern, and that's steroids and treating an ear infection if present, and just giving it time. The downsides to this are steroids have a host of side effects. Your dog or cat's going to drink more. They're probably going to have accidents in the house. Some have behavioral changes, and if they're on it for a while, it can affect liver, heart, a bunch of other things in their body. The other downside is when they heal, they basically develop like a wrinkled potato chip for an ear. It's worse in dogs than it is in cats, but if you look at the picture of this dog, that one ear had a hematoma. It was left to heal. Well, it probably had a hematoma because there was an ear infection. Now that ear is covered up by this wrinkled, or that ear canal is covered up by the wrinkled pinna, again, the outer part of the ear, and is more prone to getting ear infections more and more in the future. So you may have saved the cost of the surgery for this dog at the time, but the cost of repeat ear infections in the future are probably going to come back to get you later if you didn't pursue the surgery because of cost alone. There is a third method that I hesitate to even mention, but I've used it in very rare situations. And you use what's called a TECA cannula, which is used in large animal to treat mastitis. Don't worry about it, not going to go down that road. But anyway, you make a small hole in the ear, and you put this cannula in, and you kind of just leave it in until the skin reattaches to the cartilage. Because what the cannula is doing is it's just allowing the blood and the fluid to drain out of that ear for days. So again, you have this slowly dripping faucet, if you will, out of this dog or cat's ear for several days at a time. So yes, it creates a murder-looking scene, blood everywhere, and if they shake their head because they don't like an ear wrap, then blood can get flung on the walls, on the ceiling, anywhere. So often they stay at the vet clinic or in a bathroom that's easy to clean up or something like that. It's not preferred, but it does work, and so you may see it once in a blue moon. There is a way to prevent hematomas if you have a dog who shakes their head all the time. And there's options for cats, but if you have cats, you know cats are cats, and they're independent, and they don't like anything on them, so good luck using one of these with them. But there are ear wraps available, the most common one being the no-flap ear wrap, and they keep those ears pinned down. You can take them off, treat the ear infection with some medication, put them back on. That way your dog can't flop their ears and get a hematoma. The alternative is those big old plastic e-collars. I mean, I've been run into them, run into my ankles, stuff swiped off the tables. So e-collars have their downsides. They are fairly inexpensive and will prevent your dog from scratching their ear or rubbing it on something. Or a cat. It works much better in cats than a wrap, that's for sure. But don't get the soft ones, don't get the donuts. Your dog can still rub their ears, your cat can still scratch their ears, so those won't work in this situation. So let's recap a little bit. We've talked about a lot of stuff. We talked about otitis externa, ear infections, outer ear and pinna. We talked about predisposing factors, factors that increase the risk for an ear infection but don't cause an ear infection. Primary factors, and then causative agents like bacteria and yeast and mites. And then how we diagnose with the ear swab and the microscope exam. How we treat, thoroughly cleaning and then medicating, whether that's in the clinic or at home. And then the complications we need to look out for. So chronic ear infections and resistance. Chronic ear infections and essentially cauliflower ear. And then hematomas as well. So hopefully this was helpful. I know it was a long video. It was very in-depth compared to many of my others, but I hope you have a good grasp on ear infections, what to expect if your dog or cat has them, and some of those primary or predisposing factors you need to think about if your dog or cat starts having recurrent chronic ear infections. I'm going to try to do more presentation style videos like this, so until next time, remember to keep your pets happy and healthy.